So we have a very distinguished panel here before you today. I don't think they need any introductions, but I will just for the sake of it. We have Dr. Red Alansad, we have Dr. Amy Brenner, we have Dr. Jaime Sepulveda, and we have Dr. Maria Cantor, Uro-Gynecologist, and we're just happy to have them. They have experience with the CO2LiftV. My name is Lana Kerr. I'm the CEO of Lumis Skincare. I'm very proud to have the first carboxy gel for vaginal rejuvenation that has been very effective for women from a wide range of indications, from just dryness, painful sex, to lichen sclerosus. And we're going to be covering all those topics today, and we have this panel that's going to talk about their personal experience. Okay, so welcome, guys. All right. So let's talk about, first of all, and I'll just go to each of you as to why you thought that adding CO2LiftV was something you wanted, you thought it was beneficial for your practice. We'll start over here with Dr. Cantor.
Hi, thank you, Lana. So I added CO2LiftV to my practice because I had a significant number of patients who were experiencing dyspareunia. And some of them didn't want to go through energy-based device costs and other costs for treatments. They wanted something that was a little bit more simple, something they could do at home. And so not only do I treat patients with carboxytherapy, and I've had great success with it, I can also add for some of my patients who are maybe a little bit more far gone in terms of atrophy and dyspareunia, I can treat them with radiofrequency, I can add PRP, I can even add carboxytherapy. But I also have patients who maybe they don't want to spend a lot of money initially, and so we can start with carboxytherapy to see if they're optimized in that way, and if not, we can add other things.
So I'm gonna tell you my experience as a pelvic surgeon. I think everyone here would know about as a gynecologic surgeon. This is what we do every day. We make incisions, we devascularize areas, we put in some situations lidocaine with epinephrine. Then we put sutures, hopefully not too tight, and we apply energy. And now we expect that when we see the patient 3-6 weeks afterwards, we expect everything to be back to normal after we have devascularized the whole area, for everything to be back to normal. And then at 6 weeks, we're telling our patients, yeah, go ahead and you can resume intercourse. And yeah, at one time we had transvaginal estrogen, very 90s. We had surgeons that would put transvaginal estrogen with a packing. All those things, we know that didn't do the whole trick. So I'm looking as a surgeon to something that will revascularize my area. And of course, I cannot put a PRP on every patient that I'm going to do surgery, but I'm gonna find a way to apply carboxytherapy now and help my tissue regenerate. Of course, we all also see dyspareunia, atrophy, genitourinary syndrome, menopause, and that's definitely a big space. But for my surgical patients, I see this as, in addition to those indications, as a way to regenerate my vaginal epithelium and get better results.
I agree with all that. I'm just going to say it from a different perspective. When I first started my practice 11 years, my husband was like, you need to come up with a business plan. And I'm like, I don't know how to do that. I never took a business degree. And so now 11 years later in private practice, I think of when I started when I was 40 and now I'm 52 of, would I want to have this product or procedure? And, so before I actually brought it into my practice, I use it myself. And on the vagina or the CO2LiftV, and they also have a facial product for the face. And so just personally, I just loved these products. And so that's actually why a lot of things have eased their way into my practice over the years of I started it myself as a patient with hormones, or I wanted to have cool sculpting way back when. And so I can go on and on. And so that was one of the things is I had to try it myself to see if I liked it. Obviously, I certainly loved it. So in my practice now, we use the CO2 lift for the face. We use it as a standalone procedure where people want to do something at home. It's also a great procedure for the face on the day of an event versus other procedures you want to space it out from an event. My stepdaughter recently got married and we all did one the day of her wedding. So we also use it for the face to help with post procedure healing and just the discomfort of the procedure. So particularly with a CO2 laser for the face and the vagina, or RF microneedling for the face. So it's really helped with the comfort of the procedure as well as the recovery. And then like they already mentioned, of using it to help with the healing process after surgery, using it for people that don't want to spend as much, like Maria said, as well as I use it in my practice when particularly I do a lot of lichen sclerosis work with a CO2 laser, and the wand is 2.5 centimeters, and sometimes people are just so extreme that they can't handle that procedure. So I'll prep the tissue with a few CO2 lifts prior.
Ditto. No. I wanted to put my main points. So number one, I use it as rocket fuel. Okay, so if you have the most severe stenotic, atrophic, thin-skinned bleeding introitus and vagina, you know what, it's going to take you 2 or 3 months to get a normal, flexible, elastic vagina for them to have sexual relations. So to give it a jump start, I use this before I even start on the estrogen therapy, because this is the fastest way you're going to get those vertical vessels to show up and start getting oxygen in the area and creating collagen and elastin. Then your estrase or whatever you guys use can work better. Next, I like it for reduction in the dyspareunia for the same reason, but I do a lot. My practice is mostly surgery, so I do a lot of surgeries, and I sometimes get lousy tissue. You know, they got piss poor protoplasm, the skin's thin, they tear, and I'm supposed to repair this stuff. And so I want the best results possible, so I want the best skin possible. I'm going to pre-treat them with this stuff before I take them to surgery, because I want good skin. I want good results, and I don't want my skin to shred before surgery. Right after surgery, I like giving to them, especially for if you guys have watched my videos in the past few years, I do a lot of feathering and revisions and fixing up botched labiaplasty, so I'm doing a lot of fine work. And I want these to heal good. And so I can cut a week of healing time just by giving this immediately post-op. So that's how I use it. And then also the last thing I wanted to say was that I use it as I do it kind of like sales for the patient and tell them, you just had a $3,500 Thermiva series. Don't you want to maintain your treatments? Or you just had a set of Diva treatments. Don't you want to maintain your treatments? So I make sure that it's in the patient's brain that you got to do something to maintain your investment. It's an investment in yourself. Maintain your investment. So I tell them, you know what? You just completed your series. Maintain it by 1 tube a month in your vaginal canal, and you'll never age. When you say you'll never age, boom, it's a no-brainer.
Oh, that's awesome. Thank you. I like that. And now when you talk about rocket fuel too, rocket fuel, I always say that, there's so many things out there that work to bring hydration, moisturization, heal the skin. And it's like taking a boat to Asia. You'll eventually get there. This CO2 lift is like the jet plane. It gets there very quickly. So thank you for all your comments on that. And you guys touched on quite a bit of parts, but we want to talk about surgery first. And I know we have some surgeons here, and I know you mentioned, but is there anything that you haven't said before in terms of CO2 lift, why you would add it to your surgery that you want to say in a comment now?
Well, if you add energy, you need to get the most superficial layer, those first 1 to 3 millimeters. Or get your vascularity. Something we don't remember. We seem to forget is after our first year of histology in medical school, the epithelium doesn't have its own vascularity. The vascularity of the epithelium comes from the subepithelium. So that's where you're really working when you do carboxytherapy. it's when you came to my office and you brought the product, I searched everything that was in the product, everything disclosed. I want to know. So this is a well-established treatment with a safety profile, and that was the first thing that I told my patients: is safe, it's going to be effective, and it's not only a good option, it's the modern option to address changes in tissue. Of course, as a surgeon, I thought I was the only one getting the patients with the bad tissue. I'm glad to hear that Red also gets them. But that's the way I look at it. I don't see myself treating anything with energy without adding carboxytherapy. You can use it in the first week. Your epithelium would be that first layer will be done by the first week. So third week you're safe in that area. You may see your little vicryl sutures or your monocryl sutures. You still can use it well. And I like to see the change right on my incision line. That's the most challenging one. When we look at vaginal surgery, we dissect that subepithelium either sharply, with a laser, with radio frequency, with gauze in some situations. You need to get that back to normal.
One more thing, you can actually finish your labiaplasty, whatever you're doing, vaginoplasty, and before they leave, just put it in there. Put the first dose in, because it's soothing. It's nice and cool and soothing, and it'll increase the blood flow in that localized area, and let them go home with this like a mask for the vulva vagina area, and then they can wash it off the next day or later on that evening. So you can send them home with it.
Yes, I agree. That's when I do it as well, is do it immediately afterwards.
I agree as well.
Okay. Now, question? The face? Yes, we're going to talk about the face too. We're going to talk about the face. Maybe we'll wait on that. Okay. So let's talk about as a standalone, because we talked about surgery, we talked about laser. We haven't really even talked more about, we're going to go into energy-based devices. But as a standalone for your patients, and I know that some of you covered that, any particular experience you want to relate using it as a standalone with no other energy-based device for any of your patients? Yes?
So I have been using this product in breast cancer patients. And so if you see breast cancer patients, then you know that they have a real fear of hormonal therapy. And not only breast cancer patients, but those who are at high risk for breast cancer. And so they're looking for other options. I mean, they want something that they feel is safe but is effective. And in my experience with breast cancer patients so far, I actually find that the carboxytherapy works faster than the estrogen. So like I think Red was saying, you can get a boost, right? It works a little bit faster, and then if you want to add estrogen, you can. But in this particular demographic, I've been giving them treatments. They'll do 5 treatments, take a couple days off, another 5 treatments, take a couple days off. They do another 5 treatments. I see them a couple weeks later, and then they do 1 treatment a month, and I'm seeing them a couple weeks after each treatment, and I've seen a drop in their pH level. And we also have them doing the female sexual function index, validated scale, looking at female sexual function, and we're seeing improvement. So I've also done some before and after photographs, and there's one lady in particular, I couldn't even believe it was the same person. I actually had to go back and look at the date and time on the photograph to confirm it was her. So we're getting beautiful results. The other added benefit of the drop in the pH that I'm seeing is the potential for decreasing risk of recurrent urinary tract infection. I don't have data on that, but I do have 1 or 2 patients in whom their recurrent urinary tract infections resolved. So that's something exciting. It needs to be explored as well.
Thank you for that. Dr. Brenner, you had a point?
I found if somebody has very severe lichen sclerosus or extreme GSM, that as a standalone, I personally haven't seen somebody willing to use in a lot of these procedures. I think it's a good standalone if somebody has mild atrophy, or as a standalone in between treatments for lichen sclerosis, or somebody that just has a small amount of labia majora laxity, and for financial reasons they don't want to do RF or a surgical procedure. So it's usually in the people that want a less expensive home option.
Can someone comment on chronic yeast infections? Any experience?
I have not.
Actually, that's a great point. I know.
I use the energy in chronic yeast infections.
Yeah, that's.
So this should be the same thing.
I do have a question. How about anastrozole tamoxifen patients? Any experience?
A little experience. So I have a very small number of patients, but based on what I've done so far, if they're so far gone, so say that you have someone who was diagnosed in their 20s, had bilateral oophorectomy, and they haven't had estrogen in their body for 30 years. They're so far gone, it's hard to get them back quickly. And so I love this. Actually, I love it prophylactically too. As women are starting to go through perimenopause, you get them started on this to prevent that sort of atrophy.
Thank you.
Okay. All right. So we touched on standalone lichen. We talked about cancer patients. Are you, in terms of hormone replacement therapy, I mean, I know that you're doing that in your office. I mean, are you using it for those patients? Are you recommending it? And how are you recommending it for your patients who are doing HRT? No?
Go ahead.
So for my hormone patients, either pellets or creams or whatever your favorite choice is, a lot of them with the pellets and creams, they still have dry vaginas. I mean, like probably 85% of them don't have receptors that work well, and they're willing to take your pellets, they're willing to take creams, but they're still dry down there. And so an easy way for me to take care of these patients is I'll treat them initially, and then just one treatment a month. A lot of them don't want to place a cream or a little pill, an Invexi in there twice a week. They'd rather just do it once a month. So I give them these choices on how to treat the localized area for improvement, even when they're on pellets or other hormones.
Let's talk about energy-based devices. Now, I know we have, we'll go down the line as to what you're using and how are you using the CO2LiftV along with that, okay?
So I have approached it in two ways. Originally, if I saw a patient who had terrible dyspareunia to the point I couldn't even do a speculum exam, I felt like, I got to be really aggressive for her. So I use radiofrequency, Viviv, and then I would add platelet-rich plasma and then start her on carboxytherapy. However, because I had a few patients who were concerned about cost, I decided to start with carboxytherapy and then build from there. And so sometimes you start with the carboxytherapy and then you do the radiofrequency, and then maybe you add some PRP on top of that, and it's, they get a running start on their treatment. And so you can see how beneficial it can be getting, I think like Amy said, sometimes you treat them and then the probe goes in more easily and they're more comfortable during the actual treatment.
Go ahead.
Oh, all right. Morphis AV. Morphis V. I have used it, but I've used it right there with the Morphis AV. You saw me using it, and absolutely, they get the effect of the carboxytherapy. Something that no one has been able to explain to me is how they have better analgesia. They feel less discomfort. They feel less pain when you get it done. I'm sure we're gonna find an answer by next year. I know that we have observed that. I have not clear yet of the mechanism, but in terms of analgesia and comfort, patient does better at the time of energy.
I was in his office. So how he's using it is I don't know if most of you are familiar with the Morpheus 8V, their new radio frequency microneedling inside the vagina. So he's putting it in when you put the numbing cream, he's putting the V on top of the numbing cream. And the reason why it's working so good is because whatever you put with CO2, it's going to penetrate further. So it's going to give it a better response. And when we're going to talk about it when we do the face, and you have some experience with that as well. But it's a great, I've seen his office, his patients didn't flinch at all. And I've heard from so many different other physicians in terms of using it on top of the numbing cream for patient comfort, as well as what it's doing is pre-treating the tissue to get a better result. Okay, let's go to Dr. Brenner.
I have 3 energy-based devices for gynecology. I have a RF, Votiva. As far as with that device, that's not a painful device, so I'm more using it to prolong your success or use it in between treatments. I also have a CO2 laser and a Viva, which is a radio frequency, a probe that goes under the skin for non-surgical labiaplasty. As far as the CO2, that's my primary go-to for lichen sclerosus. And that's a uncomfortable procedure. So I'll use it to pre-treat the tissue that somebody has severe lichen or lichen plus atrophy, as well as some of those people that have severe disease to also help with the recovery after a CO2.
Okay. For my energy-based device, I have an Erbium Diva and a Thermiva. So what I do is if they have poor skin, I'll pre-treat with the carboxytherapy to improve the skin, because at least with radio frequency you need moist skin, and lasers also, they work good with water, so you got to have moisture in there before you do these procedures to get the best quality treatment. So I may pre-treat them first if they do not have good skin. Then I'll treat with their device of choice, whether it's a laser or RF. And then after that, I'll maintain them. After the whole series, I'll maintain their treatment. Again, I'll tell them, treat your investment properly, and I will give them ongoing V.
And how do you pre-treat?
I'll treat anywhere from 5 to 10 days of the gel a month before. I want thick, moist skin before I do my treatments. Generic radio frequency treatments. If their issue is strictly with moisture, I hate to say this, but after the initial 3 treatments of your RF of choice, and you use this CO2LiftV, they may not need an RF anymore if they're not looking for tightness. If they're just looking for moisture, this is really all you need. I know that's heresy, but...
You know, the CO2 lift increases hydration over 117% after one application. So that's just speaking to what Dr. Allenson was saying. All right, let's turn. The last subject now is on the face, because that's how we started with the CO2 lift for the face. And I'll just tell you how the CO2LiftV really came about was the fact that we had the CO2 Lift Pro that worked great for face as a standalone or with radio frequency or post-procedure. And I actually had gone to my GYN because I was having some sensitivity issues, and she had brought up Lana, you're just getting older. This is natural. Would you like to schedule an appointment for Mona Lisa Touch, which is what she had? So scheduled the appointment, but then going home, I thought, looking it up, it's the CO2 lift would help for that. We already have something that's working to regenerate the tissue very quickly. So that's when we did our clinical study, and we saw that it was very, not only safe, but effective. So that's kind of how it led to that. So we started with the face. So let's talk about the face here. For any of you using it for the face, Maria, are you using it for the face?
I just started.
You just started. Okay. So we'll go through and talk about using it for the face and how you're using it. Okay?
So I've just adopted the face protocol for CO2 lift. And the way we're advising patients to use it is to use it 3 times in the first week and then about once a month thereafter. And since I'm new to it, I can't speak too much to that protocol, but I will keep you posted.
Right. So this is what CO2 Lift does for my faces and neck. When you treat faces and neck, in neck especially, faces are a little easier, but necks are a little more challenging. Patient comes in, she wants to see results with the neck. You're going to go up on your rate of frequency at 25 up to 30, power of 30, and you're going to be down 1 to 3 millimeters. The CO2 lift, you saw me using it on a face and a neck, and you see the effect right away of your rate of frequency. Afterwards, face is something that you need to explain to the patient, and she's going to need some comfort afterwards. CO2 lift provides that after I do the faces, but I like the nice glow, which you start seeing afterwards, and with that's no surprise. You have the exfoliation, you have the hydration, and now you have the energy. So of course, patient is going to come back and my neck looks nice and. Microneedling rate of frequency, but you can control 1, 2, 3 millimeters, and you can even go to 4. If there's a little fat, that I can pinch with my fingers, I'm gonna go ahead and treat all the way down to 4 millimeters. We believe that 4 millimeters is gonna hurt more than 1. No, 1 is when you're really in the superficial layer, and that's where they feel it. That's where my CO2 lift comes in. And then afterwards, I try to be as meticulous with the faces that I do with the vaginas. I've been doing faces for about 3 years, and it has been very rewarding to bring it in. I'm actually, you can hear the excitement on the face is even higher than. I'm a vaginal surgeon, but it's you see it right away. Yes, yeah.
I don't do surgery on the face. The devices I have is regular microneedling, RF microneedling, and a CO2 laser. So in our practice, we include part of the price with every RF microneedling. We sell RF microneedling as a package of 3. So you get 1 CO2 with each procedure, and we put the numbing cream on, put the mask on, leave it on for 45 minutes. And then we also tell them all the benefits of CO2, and it's an option to purchase a package of 3 to use later that night to help with recovery. And we have found that this has really enhanced our recovery for we have Morpheus and our CO2 laser. What I like about it as part of our post-recovery kit, if you will, we'll also talk to people about PRP or exosomes also as an add-on to help recovery for those. Is what I like about that versus some of the skincare companies that have a little post-procedure box is, I've been gifted the post-procedure box. Well, you use it for that procedure, but then you never use it again. And versus using the CO2 lift or PRP or exosomes, it's something that my staff can talk about is it's not just post-procedure, but you can use it also as a standalone. It's also great for that person that's never done any aesthetics because there's no side effects, there's no downtime, and it's also just great for an event the day of.
I can't add anything to the face there, but let me talk about the face down here. The face I know. So, Lana talked about sensitivity, and guess what? That increased blood flow in the clitoral area helps with sensitivity. So if you have a practice that's dealing with patients who have reduced sensitivity, orgasmic dysfunction, here are the 3 secrets. RF to work on the nerves, RF specifically at below 1 megahertz. You got to get below 1 megahertz to have nerve effect. 2, work on the cellular level with PRP or exosomes, whatever you like. And 3, increase the blood flow, and you can increase the blood flow with this device. So those 3 are my 3 secret weapons for those patients of mine that say, I don't feel anything anymore. I have a hard time achieving orgasm. It's too much work. It's not even fun anymore. So guess what? Work on that face with these things, improve their sensitivity. And one other thing is that this product, I don't know if you guys have seen it, but after a series of treatments, look down there, take pictures. I've looked at my pictures, and it evens out the skin tone. It's not meant for that. Okay, but no one talks about it. The skin tone is more even. The dark areas get a little lighter. It evens out the whole skin tone because you're having new skin, new collagen come in, and over time, it's not meant for it. But if you looked at your pictures and you go, oh yeah, the skin tone is more even.
So, any specific weekend that you want to tell the patient when to use the CO2 lift?
Well, okay. So I'm going to speak to these two. So I always say that this face gets your partner, and this face keeps your partner. So like the two faces at work. But we recommend that you use the CO2 LiftV as to maintain at least once a month, or when you're going for a 3-day sex weekend, you can use it to prepare for that marathon.
There's one applicator. Yeah, you mix it in a bowl, right? So you put big pack of one, small pack of two, mix it in a little shot glass, and you put it in a little syringe. There's always some left. So after the syringe, put that inside the vaginal tissue and get the rest of it, put it on the inside.
Yeah.
You leave it out for how long?
For 45 minutes, or you can sleep with it overnight.
Officially 45 minutes.
Sleep with it. It's easier just to go to bed and wake up in the morning and take. Yes.
All right. What's the duration of the effect? How long does it last?
Great question. What's the effect? So if you did, and I'll let the doctors answer, but from what my experience with dealing with a lot of the physicians, once you do, if there was a standalone and you did, depending on your symptoms, you did 5 or 10, which is treatments, which is 2 boxes for 2 treatments, 2 boxes of 5. If you didn't do it, and you would do it every night, or what I've been doing is we started telling patients not to do it every night. The reason for some is that if it gets into the urethra, they're getting that sensitivity, that the blood flow is causing them to feel like they want to pee. So if they just space it out and have it every other night or every 2 nights, then if they didn't do another treatment, their symptoms would probably come back within 8 months if they didn't do anything else as a standalone. For 5 to 10 treatments. If that works for them, then that's what we're finding. And I know this from even my mother. She does it. She went from sandpaper to butter, and then she just is not good at maintaining. So she just, she's 6 to 8 months, she's going to do it. She does another set. And it doesn't usually, she's 73. So she did 3 boxes, 15. She was very, very dry. And all the other issues that go along with that. But when she repeated it, she didn't need 15. She just needed 10.
Every day for 5 days, every month for 5 months. That's not the problem.
Any other questions? Yeah. Yes.
Apart from lichen sclerosus, any effect on things like atopic vaginitis?
Apart from lichen sclerosus, any effect on atrophic vaginitis?
That's a huge effect. The genitourinary syndrome, menopause, atrophic vaginitis. That will kick it right in.
That's what it's for.
Right.
That's what it's for. Yes, it's for. All right. Well, I want to thank you all so much. Oh, one more thing. Yes, one more thing. Yes.
On my website, I have a whole 38-minute lecture on this, the full lecture. On AlanSottInstitute.com, the full 38-minute lecture, both basic science and clinical use, is there for you free. AlanSottInstitute.com. Look at my 15 webinars. Pick the one that says free.
So doctors, thank you so very much. I mean, we have the best of the best all here in attendance, and certainly we have them here, and they're using the CO2 Lift Pro and V and loving it. So thank you again so much for spending a little time with all of us and giving us your experience with the product. And thank you guys so much for coming and sitting down with us. And I hope you have the rest of the evening, have a wonderful evening and the rest of this event. Okay?